Post-operative instructions, general. If you have undergone IV sedation, you should be carefully attended to by a responsible family member or friend for at least 6 hours after leaving the office. Please do not drive for 24 hours or while taking narcotic pain medication. Pain. A certain amount of discomfort is to be expected with any surgical procedure. Discomfort is usually well controlled by over-the-counter medication. Depending on the complexity of the procedure, stronger pain medication may be prescribed. Make sure to eat something before taking any narcotic pain medication. Nausea is the most common sequela of anesthesia and procedure. Take all prescribed medications as directed. Bleeding. Bleeding follows any surgical procedure and should not alarm you unless it is excessive or persistent. To control bleeding, we will place a gauze dressing over the surgical sites and have you apply firm pressure. The gauze will need to be changed once every hour for the first few hours after surgery. It will be important to ensure the gauze is directly over the surgical site and you have firm biting pressure applied. If bleeding is brisk, place a tea bag under cold water. Remove excess water. Place the tea bag over the surgical site and bite down on the tea bag for 30 minutes. The tannins in the tea will help stop bleeding quicker. Remove the gauze or tea bags when eating or drinking to avoid choking. Make sure to remove all gauze and tea bags from the mouth before taking naps or going to bed. Once bleeding has stopped, remove all gauze and tea bags from the mouth to minimize the risk of choking. Swelling and discolorations. These are a normal part of the healing process and, unless extreme, are of no significant concern. Early application of ice can be helpful in decreasing the amount of swelling, which peaks 72 hours after surgery. Place an ice pack to the surgery side of your face in 20-minute intervals for the first 24 to 36 hours as you feel up to it. You do not need to do this overnight. Keep your head elevated on additional pillows, which will also help to reduce the severity of swelling. Oral hygiene. It is important to keep your mouth clean to reduce the risk of infection. Beginning the day after surgery, you can brush your teeth normally. If it is uncomfortable near the extraction site, use a dampened Q-tip or gauze to wipe down the surgical site and adjacent teeth. Avoid electric toothbrushes until cleared to do so. Do not use toothpicks or a water pick to remove food debris from the extraction site. You can gently rinse your mouth after surgery with warm water. For those who prefer to use salt, use 1 teaspoon in 8 to 10 ounces of water. If prescribed an antibacterial mouth rinse, use as directed. Diet. For your comfort, start with clear, cool liquids after surgery. Once the numbness wears off, your diet can be advanced as you feel up to it. Do not use a straw or drink carbonated beverages, and avoid alcohol for at least the first 3 days after surgery. Tobacco. Please avoid all tobacco products for the first 72 hours after surgery. Nicotine adversely affects normal healing and increases your likelihood of developing complications with healing. Call this office at 805-641-5121 regarding any concerns or complications. These can include, but are not limited to, a fever over 101.3, discomfort not controlled by prescribed pain medications, prolonged or excessive bleeding, or excessive swelling,